Hi, all, and welcome to Professor Truelove's Concepts for a Nurses series, and I am Professor Terry Truelove. In this episode, we will be looking at blood transfusions, indication that is why they're needed, and the different types of blood and blood products that the nurse may end up transfusing. Sources for this episode include Iggy's Medical Surgical Nursing 9th edition and Sol's Introduction to Critical Care Nursing 7th edition. The most common cause requiring blood transfusion is known as anemia. And anemia is the reduction in either the number of red blood cells, or the amount of hemoglobin, or the amount of hematocrit. It is a clinical sign and not a specific disease. And it is usually a manifestation of several abnormal conditions, including the inability to make more blood, such as in renal or liver disease, or through blood loss. The cardiovascular effects of anemia include orthostatic hypotension, tachycardia, especially that which increases with activity and after meals, the presence of cardiac murmurs or gallops, and a decreased pulse pressure. If the patient indeed requires a transfusion of blood or blood products, there are certain responsibilities required of the registered nurse before the transfusion. The important one is to verify that a prescription exists, that is, that the patient actually has an order to receive blood or blood products, to test the donor and the recipient's blood for compatibility, to physically examine the blood bag for identification and being intact, to check the expiration date, and to inspect the blood for discoloration, gas bubbles, or cloudiness. At the beginning of the transfusion, the nurse should provide the patient education, including the fact that they have a right to refuse that blood. The nurse should assess for vital signs and then begin the transfusion slowly, staying with the patient for the first 15 to 30 minutes. The nurse should ask the patient to report unusual sensations like chills, shortness of breath, hives, or itching, all of which could be related to a transfusion reaction. They should administer the blood product per the protocol and assess for hyperkalemia. One of the types of blood products the nurse may be giving are called packed red blood cells, or PRBCs. This is given to replace cells lost from either trauma or surgery. Indications for PRBC transfusion include anemia, that is a hemoglobin of less than 6 grams per deciliter, or it may be depending on symptoms. Normally, the PRBCs come in bags of between 200 and 250 milliliters and should be infused over 2 to 4 hours. In some cases, it's important that we give our patient WBC poor or washed red blood cells. And this is a transfusion given to a patient with a history of allergic transfusion reactions. For instance, patients who have hematopoietic stem cell transplants. 200 milliliter infusion should be given over 2 to 4 hours. Another type of transfusion are platelets, or pooled platelets. These are given for low platelet counts, active bleeding, or when scheduled for an invasive procedure. The indications are thrombocytopenia, that is a platelet count of less than 20,000, or patients who are actively bleeding with a platelet count of less than 50,000. And it is an approximately 300 milliliter infusion to be given over 15 to 30 minutes. An alternative to pooled platelets is the more expensive single donor platelet transfusion. This is given to people with a history of febrile or allergic reactions to blood or blood products. And this 200 milliliter infusion should be given over 30 minutes. Fresh frozen plasma, or FFP transfusions, are given to replace blood volume and clotting factors, such as a deficiency in plasma coagulation factors, or when the prothrombin or partial thromboplastin time is 1.5 times normal or higher. This 200 milliliter infusion should be given over 15 to 30 minutes. Lastly, the nurse may be giving a granulocyte WBC transfusion. These are given, but rarely, to neutropenic patients. That is, patients who have sepsis, a neutropenic infection, or are not responding to antibiotic therapy. This 400 milliliter infusion should be given over about 1 hour. And that does conclude this episode. However, no fear, there are more episodes to come. In the meantime, I hope you learned a little bit. I hope you plan on coming back to listen to some more, and if you are, we'll see you then. Take care now.